Good afternoon, everybody. Today we're going to look through some patient advice for caring for your wound at home during these challenging times. What you will need is your disposable dressing pack and disposable gloves. You will need the dressings that your nurse has advised you to use. You will need a clean scissors, which I've cleaned. You will need some normal saline. You will need some moisturisers for around the surrounding skin or for any of the limbs that you might be putting moisturisers on. And you will need a clean surface. And I have cleaned this surface prior already. From that now I'm going to wash my hands. So I have, as you see, I've removed all my jewellery and bracelets and rings and watches. So try and wash your hands for up to 20 seconds. Palm to palm, backs, second back, in between the fingers, thumbs, second thumb, wrist, wrist, and then in the middle of the hands here. Okay. Then you and you dry them with some kitchen towel if you have that at home. Try and dry them correctly and properly. You don't want them damp. Now I'm going to open up the dressing pack onto the clean surface. From that then I'm going to spill out the contents and I'm going to take the waste paper basket. Now I'm going to put on my disposable gloves and I'm going to remove the old dressing. I'm going to use my scissors if I need it. So I'm going to take off the dressing. This scissors has a little blunt area at the end, but you don't need to have that. Just be aware of when you are cutting the dressing. And I'm going to dispose of that in the waste paper basket. I'm going to remove the gloves and I'm going to wash my hands again. Obviously this is just for demonstration purpose. It is 20 seconds of a wash and drying on some kitchen towel correctly. Now I'm going to open up the dressings that I need for the new wound. So it's my primary dressing, my secondary dressing, something to secure it, a little cling bandage and some tape then to fix it all together. My normal saline, I'm going to pop it into one of the chambers here. And now I'm going to put on my disposable gloves out of the pack. And I'm going to clean the wound, I'm going to clean the surrounding skin. I'm going to pop one of the gauzes in, or one of the gauzes, and I'm going to clean the wound. And a second clean maybe might need it around it too. And then I'm going to just clean the surrounding skin. And then I'm going to pat dry it. If I need any moisturiser around the area, at this stage I will put the moisturiser around the area. I will apply the new dressing, my primary dressing, my secondary dressing. One moment please.
Oh, sorry, it's only me.
And my cling bandage.
Oh, right. I'll be back in a minute then.
Now, when you're applying anything onto a limb, try and go joint to joint. So they were going from the elbow to the wrist. Cut what you don't need and fix it with your Meefix or your tape. Take off my gloves, dispose of everything in the yellow bag and dispose into household. Things to look out for. If your wound becomes larger or red, if there's an increased exudate, wetness, if there's increased pain, smell or feeling unwell. And other things then to look out for: a good, well-balanced diet, sleeping is very important, take some gentle exercises, and don't lift or remove your dressing unless it requires the changing. Only change your dressing as advised by your nurse. And please, if you have any other concerns, contact your nurse or your GP via the phone. Thank you.